Hi guys, welcome back to the channel. So last class we have started with the fifth condition for developmental disturbances, that was hereditary hemorrhagic telangiectasia, which is also known as Rendu-Osler-Weber syndrome. So we have seen in that it is an autosomal dominant trait of weakened capillaries in the skin and as well as mucosa due to defective endothelial interconnection, and we have seen that patient developed telangiectatic capillary dilatation within the superficial layer of skin and mucous membrane, and which always blanch on compression. ये बहुत important है, वो हमेशा blanching show करेगा compression पे. Okay, let's continue this. Okay, so the genetic defect involves the endothelial cells, the result of which is an ultrastructural gap between endothelial cells. ये सब हम लोग देख चुके थे I guess last class में. Okay, we'll revise that. The capillaries first appear normal, and then after years of systemic vascular pressure, the capillaries spread and balloon into telangiectasis. ठीक है? Telangiectasis characteristically do not become apparent until the individual reaches his upper 30s. Once they appear, the lesion will expand in the area and number to provide symptoms of bleeding. Skin lesions are common on facial skin and fingers, and oral lesions are most notable on lips, tongue and palate. तो यहाँ तक हम लोग लास्ट क्लास में पढ़ चुके थे. Now, the most troublesome and most frequent presenting symptom is epistaxis. सबसे early sign होता है, ठीक है, from lesion of anterior septal mucosa with Kesselback plexus. तो ये नोज से होता है, नेजल सेप्टम से, मेनली एंटीरियर नेजल सेप्टम म्यूकोजा से होता है, सेप्टल म्यूकोजा से होता है, और कैसलबैक प्लेक्सस जो उसमें पाया जाता है उसके साथ ओरल हेमोरेजेस ऑल्सो अकर. तो एपिस्टैक्सिस इज द अर्लीस्ट साइन. एज गैस्ट्रिक, विसरल एंड लंग म्यूकोजा में ऑल्सो भी इन्वॉल्व, Hematomasis, melena और hemoptysis may be a part of presenting symptomatology. मतलब हर एक organ से in short bleeding हो रहा है. Okay. Now coming to the differential diagnosis, cherry angiomas, they are more diffuse, less clustered. तो cherry angiomas क्या होते हैं, इसको differentiate कैसे करेंगे? They are more diffuse, cluster में नहीं होते. Spider nevi, they are mainly present in children. Spider telangiectasis, physical diagnostic sign of liver dysfunction in adults and are seen in alcoholics with cirrhosis. Now, a variant of progressive systemic sclerosis, scleroderma, known as CRESS syndrome, manifests oral, facial and finger telangiectasis. तो CRESS syndrome में भी हम लोग को दिखता है. तो this was all about differential diagnosis of hereditary hemorrhagic telangiectasia. Now coming to diagnostic workup, complete blood count with Winthrop indices because there is persistent and recurrent bleeding episodes. तो anemia के लिए हम लोग को iron deficiency anemia के लिए we have to go for. Now serum iron and total iron binding capacity, that is TIBC. Gastroscopy or colonoscopy if GIT bleeding is there. Okay. Now coming to histopathology, skin and mucosa show same changes. The upper portion of connective tissue contain irregularly dilated capillaries and venules lined by flattened endothelial cells. तो जो स्किन का हिस्टोपैथ होगा, म्यूकोसा का भी सिमिलर होगा. मेनली क्या होता है, जो कनेक्टिव टिश्यू होता है उसका जो अपर पोर्शन है उसमें हम लोग को डायलेटेड कैपिलरीज और वेन्यूज दिखेंगे विच आर लाइन बाय एंडोथेलियल सेल्स, बट वो एंडोथेलियल सेल्स कैसे होंगे? फ्लैटेंड. Perivascular supporting tissue is edematous and contains abnormally constructed fibrils. और जो perivascular supporting tissue है, surrounding tissue, वो edematous होंगे. Coming to the treatment plan, no treatment is usually necessary other than local hemostatic measure during small bleeding episodes such as silver nitrate cautery and surgical dressing. तो जनरली ट्रीटमेंट रिक्वायर्ड नहीं होता, लेकिन कभी कभी लोकल हीमोस्टैटिक मेजर्स हम लोग ले सकते हैं for small bleeding episodes such as silver nitrate cautery and surgical dressing. Okay, that's all for today. We'll be continuing this in the next class. Till then, like, share, subscribe and comment. Bye.